Hello, today I have a tutorial on how to do a proper diaphragmatic breath, sometimes known as belly breathing. So essentially belly breathing or diaphragmatic breathing is about accessing the lower portion of our lungs in the breath. And what happens to many of us is that we tend to stay into the higher regions of the lungs when we breathe in and out, a more shallow breath. And so it's good to do a little checking in to see if you are accessing the lower lungs. Because when we're doing that, by filling down low into the lungs, not only is it better for getting more oxygenation into the body, but it encourages bigger movement into the diaphragm muscle. And the diaphragm muscle is a dome-shaped muscle that lines that bottom layer or area of the rib cage. And essentially the movement of the diaphragm is such that when you breathe in, it contracts and moves downwards towards the abdominal cavity. And then when you breathe out, it returns up into its dome shape up inside the rib cage. So on the inhale, it shifts down and flattens, and exhale, it returns back up. So you can even use that as a visual as you start to learn this technique. So first of all, come into a seated position that feels comfortable. You don't need to be on the ground, you could be in a chair. And we want to find our way into sensing that the core of the body is pretty relaxed. So through the stomach area, if you're really tensed or like doing that sucking in or pulling in, you're going to have a hard time accessing the lower lungs, and it will restrict or constrict the movement of the diaphragm. So we're going to encourage that breath by softening those stomach muscles. You could also even place your hands at the level of the abdomen. And it just gives you some awareness here. And we're going to start to do some breaths in and out through the nose. And as you inhale, you want to visualize that air going down low into the lungs. On the exhale, just gently retreats back up and out. And you're encouraging, as you breathe in and out, that it's like you're imagining that you can fill into the belly with the breath. And so hopefully you would start to notice some expansion out through the ribs and belly as you inhale, and as you exhale, it would drop back in gently. Now we want to be able to do all of this without an upward shift or shrugging motion into the upper frame of our body. All of the muscles into the shoulders and chest are trying to stay relaxed and basically out of the picture. So try a few more rounds here, breathing in and out, seeing if you can connect to the movement. Inhale, filling and expanding. Exhale, releasing and drawing back in. Relax shoulders, relax face. And then combine this pattern of breath and movement with that visual of what the diaphragm is actually doing. So from the inside of the body, as you breathe in, picture that diaphragm descending down. And on those exhales, it draws back up. And just take a couple more breaths trying that out. Good, okay, so you can relax from there and let that go. So a note about that is that if it doesn't feel like it's easy to do, that's fine. It just takes some practice. I encourage you trying it in various postures, lying down on your back, sitting, standing even. The more you practice it, the more you should be able to sense there's movement into the lower region there. And just remember that this is a great way, a simple technique for you to help start to regulate the breath and also the nervous system. And so there's a calming effect to this diaphragmatic breath. Definitely worth learning. So good luck with that, and let me know if you have any questions. Thank you.